Hi everyone. My name is Vanessa Haken. I'm today with you here with the Columbia course regarding adaptation in climate change and health. Our today is the October 14th, 2025, and I'm speaking directly from Brasilia, from our Ministry of Health from Brazil. It's a great pleasure to be here to be part of this very important action to scale up actions regarding adaptation and climate change and health. So today here we have three presenters, and I will present all of them in a second. So first, I'd like to name our course. It's Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. Today, we are at our sixth session, Challenges in Communicating Scaling Up Efforts. So today, we're going to be talking about communication, and how important is that for adaptation and for saving lives, because this is about saving lives. I would like to welcome everyone that hears us and will see us even afterwards, since this course is being recorded and can be assessed afterwards by anyone who's interested in this theme. So let's go to our next slide. So we have a few information for you in this very beginning. You can find our Zoom the interpretation, so simultaneous translation is available in English, Spanish, French, and of course Portuguese, using the button with the globe icon over here, as you can see. I already talked about the name and the title of this sixth session. So regarding communication, our course objectives is to first understand the importance of rapidly scaling up climate change and health adaptation actions to prepare individuals, communities, health systems, everyone for more severe impacts expected with climate change, unfortunately, but that's information. Describe key actions for scaling up health adaptation within their jurisdiction that support health and well-being and that can help communities prepare for more severe climate hazards. Identify opportunities for increasing health adaptation efforts that support health and equity and increase climate resilience. This is about resilience. And be prepared to work with a broader range of partners to address current barriers to health adaptation in their jurisdiction and take advantage of opportunities to scale up efforts. Because we need a change, and we need to change fast. So we need to scale up efforts. We have a few learning objectives for this sixth session, which is to develop targeted messaging strategies for different stakeholder audiences to build up support for health adaptation scaling up. Design advocacy approaches that generate political and financial support for large-scale health adaptation investments, because for change we actually need financing and political will. Utilize communication tools to maintain momentum and accountability across extended scaling up timeline. So we'll have today a 90-minute sessions. We're already 5 minutes through. The sessions will end with a question and answer section. So you can put at the Q&A your questions and issues you like for our presenters to explain a little bit more and to debate. Enter questions over there. There is a Q&A icon in the Zoom. Sessions, video recordings, slide decks, and resources will be made available on the course website. Great. So your attendance is automatically recorded during the live Zoom sessions. Individual attendance is only counted if you join using a personal Zoom link, as you already know. And your attendance is not counted if you don't do it that way. YouTube views will not count towards attendance, but they are welcome afterwards, of course, for anyone that wants to learn more. And you have some certificate of participation also. You already know about this. And please join our WhatsApp group in case you want to receive more information and documents regarding this theme. So here we are finally with our presenters for today. We'll have Teresa Myers speaking from Ohio. We'll have Ana Rosa Moreno speaking from Mexico City. And finally, Jaqueline Machado speaking from Rio Grande do Sul. Teresa Myers is a research associate professor at the Center for Climate Change Communication at George Mason University, United States. She's currently co-principal investigator on a NASA grant investigating public trust in NASA's climate change research. Very interesting. Let us know more, Teresa. And public understanding of NASA's web-based educational materials on climate change. She also analyzes and publishes research using the climate change in the American Mind data and works with a team to evaluate the Climate Matters broadcast meteorologist engagement project. In addition to work on climate communication, she enjoys survey and data analysis research methodology. Thanks very much, Teresa. The floor is yours.
Thank you. And thank you all for having me. I am excited to share with you today some of the work that I and colleagues have been doing at the Center for Climate Change Communication, specifically focusing in on this idea of strategic communication for action on climate and health. First, a little bit about our center. We call ourselves a think and do tank. So we conduct communication research in service of solutions. We identify opportunities to enhance public engagement. We activate trusted voices, and we train leaders, what we're doing today, in the science of science communication. I bring this up because really what I'm going to be doing today is sharing a little bit of both our thinking and doing. So I am on the research team, and I'm going to be sharing the work that our partners and collaborators at the Medical Society for Consortium for Climate and Health, and the work that they are doing as well. Broadly, I'm going to be talking about evidence-based guidance for effective communication campaigns that can be scaled up, which can be summarized in this kind of one sentence big idea. This idea that effective communication campaigns should utilize simple, clear messages that are repeated often by a variety of trusted voices. And what I'm going to be doing today is breaking this kind of big picture down and illustrating what, for example, simple, clear messages might look like, in an effort for you to think about in your context, what are the messages that you can use, for example, and how can you scale those up for the most effective communication campaigns possible? So we'll focus here first on this idea of simple, clear messages. So what is necessary first is to really clearly define your goals. So as an organization, as a collective, as a network, what are you trying to achieve in order to have a long-term impact? Is it public education? Is it policy change? Is it behavior change, individual behavior change, or whatever your goals may be? And then starting with the end in mind, this is what you're looking for. What messages and communication strategies can get you towards that goal? So, like I said, I'll be utilizing the example of our partners, a program of the Mason Center for Climate Change Communication, the Medical Society Consortium on Climate and Health. And so you can see here the consortium's defined goal is this idea of mobilizing health voices for climate action. So the end goal is climate action, and the kind of strategy for getting there is mobilizing health voices. And so thinking of this end goal for your organization, especially within the context of attempting to scale things up, it needs to be specific yet broad enough to encompass the range of activities that you're hoping to pursue. Secondly, what you want to do is outline your messages. So we want them to be simple and clear, right? Why? Because the less you say, the more you are heard. And I say this as someone giving a 35-minute presentation, right? But the more you can boil your point down, the more it is going to be received and understood. You want to say the things that have the most value to your audience, right? So we tend to think first about what we want to share with the people we're talking with, right? And we're arguing again, keep the end in mind. Who is your audience and what are the things that will be most useful for them, most likely to galvanize them to action, most helpful for them? And those are the things that you want to focus on saying. And how can you determine that? If you don't know, right? One of the key tools that we utilize here at the Center for Climate Change Communication is using audience research to determine what has the most value. So these are the kind of background ideas behind this idea of simple, clear messages, right? That you really want to boil it down to be able to distill your message into what is most important, easy to remember. And to do that, you may need to do some research. I'd next like to transition to some of the research that we have done. What we have found are the messages and message characteristics that will most resonate on climate and health. So I'm going to present just a few of these. We have a lot more guidance and information on our websites for the Center for Climate Change Communication or the Medical Society Consortium on Climate. But these are just a few of the key kind of ways for simple, clear messages to make the most impact in the realm of climate and health. So the first is this idea of making connections. So this is making connections between climate and health and people's lives, right? So you all work in this field, you're taking this course, you probably intimately understand the many ways that climate change impacts health. But for many people around the world, that is a much more abstract idea, right? And so there's a kind of simple formula that our research has found that helps make this connection between climate and health and engagement of audiences. So I'm reporting on research done by some colleagues of mine at the center, and they found that reading about health harming pathways of climate change, so it illustrating how climate change affects air pollution, extreme weather, mental health, for example. So these pathways and connecting that to the who of who is most likely to be harmed. So how air pollution affects asthma in children, for example, or in pregnant women, or how extreme weather affects outdoor workers increases both cognitive thinking about and affect emotional engagement with the issue, especially in American audiences among political moderates and moderate conservatives. So, as you may already be aware, it's such a polarized issue in the United States, specifically among conservatives. And this research found that making these connections between climate and health increased both thinking about and emotional engagement with climate change. So make the connections, the what, the who, and the why it matters. A second message characteristic is to really emphasize the present benefits of action, right? So often climate change is thought of as a faraway issue happening somewhere else in the future, right? But through illustrating the present benefits of solution pathways, we can actually increase engagement as well. So this is research done by the Medical Society Consortium, and they find that solution pathways like using clean renewable energy, climate smart foods, active transportation, and improving our building, along with community environments like walkable, shaded, cool communities. While the climate benefits of these policies take years to accrue, and it's in small measures kind of dispersed worldwide, the health benefits happen immediately. And they're very concrete and local, right? You can take a walk down the main street of your town and notice that it's a lot more shaded and pleasant, right? Which also has multiple benefits. A more walkable, cool city is beneficial for health, but also for climate change. And then Additionally, it's super important to use personal stories, right? So the consortium has a series of um, stories that they've published. Here's one example. This is a nurse from Phoenix, Paloma Greenwald, and she tells the story of how a woman she knew who was a cleaner in airplanes who worked overnight was hospitalized in the ER and then for a week-long stay with kidney failure after working in extremely hot conditions due to increased overnight temperatures, right? So that this idea of hotter nights impacts real people, not only health-wise, but financially, right? Losing a week of work, etc. Another example is a physician, Dr. Byron, who lives in Montana, described watching over a quarter of the drinking wells on the reservation that she worked on dry up. And additionally, many of the ranches that were the livelihoods of families in the area became too dry and arid for farmers to work the land, right? So this connects the kind of climatological abstract ideas of extreme heat with the livelihoods and health of people around the world. So these are some message characteristics, making the connections, using personal stories, emphasizing present today benefits to health that really resonate with multiple audiences, which is where I want to transition to next, which is the importance of really knowing and understanding your audience. So not only do you have to really think about what are the messages that need to be shared, you need to think about which messages need to be shared to whom, or this idea of targeting, right? So, who are your most important audiences? Is it health professionals? Is it patients? Is it politicians? Is it the general public? Is it something else, right? You know. And I would encourage you to think about it not just in kind of these broad terms, but in more specifically, who are you mobilizing? Those are those people who are already in agreement with you about the importance of the issue. They're convinced that climate change is harming health. They think your community or your nation needs to do something to address the problem, but they don't really know what to do, right? Or they haven't yet figured out what are effective ways to move forward on this issue. So, who are the audiences that you're mobilizing, and what are those messages that those people need to hear specifically, right? They need to hear about the work that makes a difference, how they can get involved, etc. Secondly, who are you convincing? So, those are people who maybe you're just disengaged with the issue, right? These are folks who are like, well, I've heard things, but I don't really know what to think. Why is this trustworthy? Right. So these are those folks that you really need to get connected with, maybe scientists or medical professionals. So define for your community or your organization who are the people you're mobilizing, who are the people you are convincing, and finally, who are the people you are opposing? These probably aren't your primary audience, right? Like you may or may not be trying to convince those you're trying to oppose. But certainly, some of these other people, those you are mobilizing and convincing, are listening to those opposing voices as well. And so it's really important to understand, what those audiences currently understand or misunderstand about the issue and what their values are as well. So, in the context, the example of the Consortium on Climate and Health, seeking to mobilize health professionals to engage with local, state, and federal policymakers and oppose the harms caused by the fossil fuel industry. So here's some research that we've done to kind of support this process. So mobilizing health professionals. So this is a multinational study conducted, finding that global health professionals largely understand that it's happening and caused by humans. They viewed climate change as an important and growing cause of health harm and felt a responsibility to educate the public and policymakers. So these are people, by and large, that we found really are on board, but many didn't know what the next steps were. Additionally, we had this goal of engaging policymakers across all levels, right? Specifically finding that policymakers have this really false understanding of what this is the American public, what the American public wants in terms of regulating carbon emissions as a pollutant, for example. So we found that those on the left side of the spectrum, the Democratic staffers, by 5 percentage points underestimated support among the American public. And among the Republican staffers, it was a full 31 percentage points. Their estimate of what percentage of the public supported this was 30 points less than it was in real life. And so illustrating this difference was really important. And then finally, our research has found that really calling attention to opponents of climate action is effective. So this is specifically calling out fossil fuel industry, increased attitudinal engagement, support for policy, and intentions to advocate for climate solutions, especially among political conservatives, right? So this three-pronged approach to simple, clear messages of, who are we mobilizing, who are we convincing, and who are we opposing really helps define what the simple, clear messages are. Okay, so that is the first piece of this kind of mantra, if you will, for how to build effective communication campaigns that can be scaled up. The second is this idea of repetition. So repetition is incredibly powerful. It is the mother of learning, liking, and trust. Okay, so when people hear you repeat the most important, simple, clear messages, they're going to hear it, they're going to remember it, they will like you more, and they will trust you more, right? So when you stay on message, broadly defined, it really increases the impact of what you're trying to do. Yes, part of repetition is adapting and elaborating, right? So you may not say the same thing in the same way to every single audience, but it's important to deliver your messages that you defined for your goals frequently and early, right? So you get it out there and you just keep pounding it home. And then finally, you can repeat by reinforcing with visuals and metaphors. So really clear pictures are a way of repeating visually what you're trying to say with your words. And then metaphors, right? Like in this example, we're trying to have a choir singing together, right? It's a bunch of different voices. So the way the message is delivered might be slightly different, but everyone is kind of working together for the same cause. So an example of this is the stories that I referenced earlier, right? So these are all the main kind of simple, clear message is climate change impacts the health of real people in concrete ways, right? And then we have here 4 different examples of how that looks like in the medical profession, right? So this is an example of adaptable repetition, right? It's driving home the simple, clear message in a variety of different ways. And so repetition for you might look like different people saying the same thing or finding different ways to communicate your simple, clear messages, right? Using different metaphors, using different visuals, videos, blogs, whatever, infographics, etc. So this is the power of repetition. And then finally, I want to spend the rest of our time talking about this idea of a variety of trusted voices, right? So especially for this idea of communication campaigns that can scale, it's so important to not just be the singular voice on this issue, right? You want to bring in as many as people as possible who are trusted by your audiences to repeat these simple, clear messages. So the importance of trust. But it's not just trust in the abstract, right? It's who your audiences trust, right? Who are those that you are trying to mobilize and convince? Who do those people look to get their information? Who do they perceive as having credible information on climate change and health that is accessible and available and understandable to them? So taking a step back and thinking about broadly the issue of climate change and health, we find that health professionals are incredibly well suited because they are trusted across, many aspects of the public. So this is again some American research conducted by Gallup, and they found that medical professionals were 3 of the 5 most trusted professions. So they asked, I don't have it here, I think it was 21 different professions. Only 5 were majority positive. That means most people had high or very high perception and rating of the honesty and ethical standards of people in these fields. Nurses topped the list, followed by teachers, military, then pharmacists and medical doctors, right? So you can see here that people in medical professions are extremely trusted. And this has actually wavered back and forth through COVID a little bit, not the kind of absolute numbers, but they have always been at the top of the trust perception, right? So for the consortium, the idea is to really gather these extremely trusted voices generally and galvanize and activate them to speak on behalf of action on climate change. So in this context, then targeting, partnering with medical professionals, the next question becomes, who are the key models in the professions or the communities that you are engaging, right? So if you know, okay, this group of people are trusted, who are the people that are the leaders within that group, right? So think of opinion leaders or models. And the question is, how can you highlight the work that they are doing, right? And how can you partner with them as well, right? But who are those who are kind of leading the way within the community or the profession? Are they trusted by the audience that you're ultimately trying to reach? And what can you do to partner with them and highlight the work that they're doing? Additionally, you can ask them specifically to convey your message, right? So this is a really important piece of the puzzle. Not being asked is the leading barrier of climate action. So I will share some of the work that our center has done kind of more with the general public. We found that 78% of Americans haven't ever been asked to contact an elected official about global warming. 67% have never been contacted by an organization working to reduce climate change, but many of them say they would act if a person they like and respect asked them to, right? So here, for example, this is the result of some research we did in 2021. We were asked, in the past 12 months, have you signed a petition online in person about global warming? Only 16% had done so. But 50% said they definitely or probably would if someone they liked or trusted asked them to. And you see similar results about donating money, volunteering time, contacting government officials, right? This illustrates the broader idea that we've seen in mobilizing health professionals, which is this idea that being asked is extremely powerful, right? So thinking about these models, the opinion leaders of the groups that you are trying to mobilize, the trusted voices, ask them if they would partner with you in sharing these messages. And then finally, make it really easy for them to do so, right? If they agree with you attitudinally and they have said yes, what is it you can do to make their lives as easy as possible in this process? So, for example, barriers to action as reported by health professionals. So this is continuing the results of the research that I described before, which found that global health professionals are convinced that climate change is harming health. They think it's really important. They want to advocate on their behalf, but these are the top 5 barriers that they report. Number 1, time constraints. I'm sure that is no surprise to anyone here on this call, right? Medical professionals are extremely busy, as are most people, right? And so that was the number 1 barrier cited. Lack of knowledge came in 13 points under that, but still over 40% of participants indicated, I don't know enough to effectively act on this issue. Next was the belief that it wouldn't make a difference. believing there was little support from their peers, or finding that the topic was too controversial. So we're going to break this up and talk about how, kind of as a center, we recommend addressing these specific barriers. But the broader point is for you, for your audience, and for those people that you are attempting to mobilize and um, encouraged to advocate in whatever specific way. It is super important to understand what their barriers are and then really concretely think through, okay, how can we address these barriers? So first, this idea of time constraints and lack of knowledge. We recommend providing nuts and bolts resources. What do I mean by that? Like as concrete and practical as possible. Resources that make it easy for them kind of right out of the box um, to do what you're asking them to do, and pairing that with continuing education. So here's an example of something I think our partners at the consortium have done really well. This is part of a much longer document. Key messages and guidance, core messages about climate and health. And so they provide just very concrete language. And this is available on the consortium's website, and I can provide links later as well. But it just provides some sample kind of what this might look like in practice to talk, right? What is important about this is this allows people who are kind of wanting to take this message and go to adapt it to their purposes, but provides an example that they can work from. And the rest of this kind of guidance memo builds on how that might be adaptable for their specific context. Additionally, as part of the annual conferences, we offer continuing education credits, right? So for whatever group you are trying to mobilize. So I've also worked extensively with meteorologists, right? So at the annual meteorological conferences, we would also provide education credits for various seals of approval that meteorologists can earn. So going to where they're already going, meetings, conferences, message boards, whatever it is, and seeing what you can do to integrate with what they already have and offering education there as well. Next, this barrier, the belief that, if they advocated for action on climate and health, it wouldn't make a difference. This is where it can be really important to highlight success stories, right? Talk about how in New Mexico, they're getting committee hearings on this idea of protection for vulnerable workers in extreme health, for example, in extreme heat. Pardon me, I misspoke there. The consortium does this through their monthly climate champions, but there are many different ways that you could do that, right? So highlight success stories. This idea that there is little support from their peers. Nobody else is doing this. I'm going to be ostracized if I do this within my profession or within my community or whatever. And this is the power of networking and convening, right? What is your role on whatever level you're working, whether it's nationally, regionally, locally, to really bring together the people who are wanting to work in this area, right? So the consortium, that's a major goal, right? They're currently state network groups, medical societies. There's this fellowship. It's a multi-pronged effort to really network. And then there are these annual conventions as well, both online and in person. And so the importance is to show there are peers in their profession or in their community who are acting and care about this, but you just have to make it more visible, right? And then finally, there was this barrier, this belief that the topic is too controversial, which is obviously also a common belief. And our guidance here is to really research the fears that your participants have. So we think the core fear behind this is that, advocacy on behalf of climate action and to address climate health harms will impact trust in their profession. So I'm going to share some tangential research that we've done that speak to this, this is also a concern of scientists more broadly, climate scientists. And so we tested whether advocacy affects trust in scientists. And the evidence suggests it does not. In fact, among some audiences, it increases trust because if you're so convinced this is a problem, you should be doing something about it, right? And so we found that, after we tested kind of head to head experiments of scientists advocating or not on this issue, participants reported that they had the same amount of trust no matter which group it was in. And some groups even were more trusted after they advocated. So the idea, though, the broader idea is this idea of, okay, who are your trusted voices and what can you do to really support and help them take more steps towards advocating for your goals? How can you bring together under this big tent people who can speak up and repeat the simple, clear messages that you are really advocating for? So, in summary, this is the big idea. For you and for the work that you are doing, what are your simple, clear messages? How are they going to advance your goal? Who are you trying to reach? How can you maximize repetition by a choir of trusted voices? If you would like more information, here's a QR code. Here's our website. We'd love to help you more. Thanks.
Amazing, Teresa. Thank you very much. So much crucial information that we really, really need to scale up information and to actually engage audiences. Because I think the most important thing here is to actually address people, get to the territories, get to real people's lives, and actually engage everyone in this mission, in this human mission that we have to actually change the course of our history. This is about a historic mission. So now, thanks very much, Teresa. So now we'll have Ana Rosa Moreno speaking from Mexico City. Just a second, I'll read Ana Rosa's curriculum. So Ana Rosa is a biologist, graduated from UNAM, from University of Mexico City, a master in human ecology and health from the School of Public Health, University of Texas in the USA, works with risk communication consultant for the Pan American Health Organization, PAHO, and World Health Organization, and for the governmental and private sector, including Petrobras in Brazil and many others. Worked 11 years at PAHO in environmental health, risk communication, and as manager of many projects, is a professor retired from the Department of Public Health of the Faculty of Medicine of the National, so UNAM, National, now with the whole name, National Autonomous University of Mexico, a member of the United Nations Intergovernmental Panel on Climate Change, IPCC, since 1995, participated of almost all of the reports, assessment reports, amazing, consultant on environmental health and climate change, and health for the United Nations Environmental Program and United Nations Development Program, author of not less than 96 national and international publications, many of them regarding climate change and health and risk communication. Thanks very much, Ana Rosa. The floor is yours.
Thank you very much. Muchas gracias. Voy a compartir pantalla. Voy a hablar en español.
Let me first share my screen. I will speak Spanish during my presentation.
Con una reflexión
And let me
relacionada con
start
lo que es la comunicación de riesgo.
by speaking about risk and communication. Of course, focusing on the risks
El análisis
of
es
climate
que las
change.
personas no responden directamente a los fenómenos que amenazan a una comunidad,
These
sino a la percepción
people
individual
don't
subjetiva en torno a
respond
estos riesgos.
directly to the
Estos
events
relatos
that affect a
informan
community,
en
but
función
to
de
the individual
experiencias,
and collective
creencias,
perception
sentimientos,
around it. And
necesidades,
these
marcan
narratives
hábitos
are
culturales. Y de
formed
ahí la dificultad de
according to
articular
the
respuestas
experience,
eficaces para reducir
beliefs,
la
feelings,
vulnerabilidad
needs
de los
social and cultural frameworks. And so we have the difficulty in coordinating effective efforts to climate change. I'm also going to discuss emergencies. During public health emergencies, people need to know what risks they face and what measures they can take to protect their lives and their health. The accurate information that is timely and provided through channels and in languages that people understand will enable them to make decisions and to act to protect themselves, their families, and their communities against the risks that can threaten their life and well-being. The consequences of the climate emergency affect all aspects of human life, and so we shouldn't just address it in the environmental section in media. This has an effect on the economy, politics, health, and the culture. People don't directly respond to the risks they're exposed to, but to their perception of those risks. And this is an important consideration because there are communities that often suffer events such as floods, the ones we have experienced in Latin America in the last few years, for example. And so it's necessary to develop our capacity to communicate risks at the national, provincial, and local level. And this is especially important in large countries such as Brazil, Argentina, Mexico, where each region has specific environmental, cultural characteristics. And so communicating risks needs to adapt to these. For example, in Mexico, in the southeast, we have a tropical area that frequently faces floods. But if we travel north, we have a dry desert area. So the risks are different. And so how can we take care of the populations depending on where they live, the risks they face, for example, heat waves in the north of Mexico, or what happens to workers, because it's not the same for someone to work in areas that have in agriculture where people are working there for long hours, exposed to the elements without drinking water. And so men in particular start facing kidney issues at a young age. And so each region, depending on the characteristics of the environment, the culture, the population, needs to have a communication that is targeted to them to address the risks. The lack of development of local capacities for communities for communicating risks has led us to believe to depend on external experts. I have trained experts and people in all places in Latin America on risk communication, and all the time people tell me the person who should be here is my boss, because they have no idea on how to communicate people and to empower them to be responsible and to act responsibly when dealing with high temperatures, floods, etc. So we really need to take this as a serious matter to protect the health of people and to protect the most vulnerable people in particular. We need to move away from the jargon of climate change. We need to speak more about people. It's a way of humanizing the coverage about climate health, climate change. We need to cover the stories of the people affected. Each person has their own story, their own ideology, their own education, background. their own life story, the place they have lived, the place they have had to migrate to. Migrants are having lots of problems because they arrive at a place and they don't know the climate risks that they face there. So we can't discuss communication as something that is abstract. This is something that reaches people, and people are diverse. And so this is a challenge for a lot of the media that don't have the resources to travel to the places where people are facing these events. But it shouldn't, this coverage shouldn't be something that is incomprehensible, that nobody cares about. And many times there isn't a check to verify that the education given, the information is being understood, to check whether people are taking ownership of the messages, because many times people who work on this write a message and they, for example, I myself, it happens to me, I say, oh, this is a beautifully crafted message. And sometimes I bring this to my husband who doesn't work in this area and for him to read. And he says, well, but what do you mean here? So the fact that we are experts on something doesn't necessarily mean that we can communicate well. So we should test our materials all the time. We have to be humble about it and recognize that this can always be improved. Communication of risks can provide various tools for managing the various stages and conditions of disasters. The question is, how are we communicating this? Is it biased to the trained technical staff? And this has to do with testing our communication and our message. This was an example. This is a big example. During epidemics and pandemics, humanitarian crises and disasters, effective risk communication enables people at great risk to understand and adopt protective behaviors. And so during the COVID pandemic, something I have discussed with people at PAHO, we reached the conclusion that even though certain groups in some countries had trained on how to spread information about a new risk, practically nobody knew how to do it. And many countries made serious mistakes in communication. And this is something that hasn't been assessed. Why? Because overnight, they, for example, put an epidemiologist at the head of the issue, but they didn't, you might be a great epidemiologist, but they didn't know how to communicate. And this goes from body language. This is something I always say in my courses. It's really important. For example, if we cover our mouth when we're talking, we are signaling that we're unsure of what we're saying. Unconsciously, we are covering our mouth because of that, because it's something we're not certain about, because we cannot know everything. So I can say, as far as I know, this is the information I have. But during a crisis, information can change overnight. And so we need to adjust to that as well. And so we also have, for example, researchers that have information and they are brought to the media to talk, but they speak using a language that not everybody understands. It might be too technical. And so we need to find information that can give out the information in a way that anyone can understand it. Also, for communicating risks, we must focus on the authorities and experts being able to address the concerns of people so that the advice that they give is relevant, reliable, and acceptable. it's not just putting somebody there to speak, to open their mouth. They need training. They need training on the language, on how to share this information. Also, we need to think of the answers they are going to have to a series of questions. They need to think of this in advance. For example, on September 11, Mayor Giuliani, who I always remember was in charge in New York, had a journalist ask him, how many people do you calculate have died? It was obviously a difficult question to answer precisely. If he gave a number, then they were going to check it against what the real number, and it had been too small compared to the reality, or he could have exaggerated. And he said something that I always remember, because he said a lot more than we could have allowed. And so it was a great answer, because he didn't give a precise answer because he didn't have it. And so saying so many more than we could have allowed was a great answer. So, but was that something he came up with in the moment? No, he had training for a week on how to communicate. And so it's important for experts to address the concerns of people, to provide relevant, reliable, and acceptable advice. To build trust, risk communication interventions should be linked to functional and accessible services, be transparent, timely, easy to understand. They must recognize uncertainty. They must address affected populations. They must link with self-efficacy and be disseminated through multiple platforms and channels. And so we need to strengthen networks of agencies and organizations across geographic and disciplinary areas, and also across national boundaries. This is really important in large countries. We need to take into account the culture. For example, in the north of Mexico, men speak at a high volume, and in a way that if there is someone from a different area of the country, they might think that it's rude, that it's someone who's impolite, but it's a culture thing. And so when we communicate risks, we also have to go to places where the culture is different. And so we must not judge or draw conclusions that perhaps is something, a person is someone we might reject because of that. We need to adapt information and communication systems to the needs of users and involve stakeholders. Communicating emergency risks is, of course, an integral part of any emergency response. And climate change emergencies can take very different forms. It has to do with the real-time exchange of information, advice, and opinions between experts, community leaders, or officials, and people at risk. We see this often because it's happening when we already have the event going on. And so we need communication experts, but the expertise also involves credibility. When we have a person in front of us, and for example, they are swinging from side to side, then that tells us unconsciously, the body language tells us that they're uncertain, they're insecure. You know, we connect that to when we are inside the womb of the mother and we are confronted by that movement. And so when we don't know about body language, Well, we might not understand exactly, but we see something that is not letting me connect to what that person is saying. So that training is essential when we're communicating risks, because if we are discussing a risk, but we have a person in front of us that is not looking people in the eye, when we give a speech, when we're at a conference speaking to people in front of us, we need to look them all in the eye, because if we don't, we're not recognizing their humanity. By looking them in the eye, we capture their attention. And so we are looking at them and we're obviously telling them, you matter to me, you matter to me. And so this, of course, involves training. It's also important to study, to develop, to apply and coordinate technologies for disaster prevention, promote professional and technical training in this area, and support the dissemination of disaster preparedness and self-protection measures. A disaster has to do or shows us our fragility. And so we need to see how we're going to deal with that fragility. And the main functions are research, implementation, training, and dissemination of risk communication. Planning of risk communication should be done well in advance, and it's a continuous, ongoing process focusing on preparation and response. We need to assess the needs, set goals, implement specific interventions, monitor and evaluate intervention activities to improve awareness and to influence behavior before, during, and after a public health emergency. So going back to this, we are speaking to people who are vulnerable. We are speaking to people who are afraid. We are speaking to people who may be injured, people who may have lost a loved one in this emergency. So empathy is essential here. And empathy starts at the moment where we become close to someone who has suffered this event. We should have a team of staff trained in health crisis and risk communication, and they should have at least once a year some update. The media personnel should receive training in public crisis communication. We used to have that in university. There used to be an area for communicators where they would be trained on crisis communication. Crisis is an entirely different process to manage. Risk communication should be integrated into health and emergency response teams. It doesn't necessarily happen, and communicating risks for health protection must be a part of the preparedness and response teams for health systems. As for follow-up and monitoring tools, we need research to establish the mechanisms and methods for evaluating risk communication interventions, because every time we use this, we need to evaluate, we need to find where we can improve, what was wrong, what was lacking, what wasn't necessary. Incorporating the findings of this assessment and feedback from stakeholders and communities to inform and improve current and future responses. Journalists should be able to communicate how the climate emergency connects to the economy, politics, health, and even the elections. All of them, they should know all the basics. We need journalists who are trained in a dynamic of dialogue between colleagues when questions arise. So the empathy I mentioned before, it's not the same of telling, for example, in 2 paragraphs, how the neighbors protested against something, than to go there and to listen to their memories and to go to the place where it happened, understanding their fears, and perhaps share with the reader. This takes longer, of course, but it improves the quality of the communication. So we have to be empathetic. We cannot speak of empathy if we don't have empathy to individuals. If we don't know how to communicate with someone who lost their house and are crying because they lost their house, or if we go somewhere where there was a landslide and they have family members that were trapped there and they can't find them. And so we need to be empathetic. That is very important because many of the populations in Latin America suffer this, and we know how hard it can be.
Monitoring and evaluation tools. Research is needed to establish the best mechanism and methods for rapidly evaluating CRE intervention, and to incorporate assessment findings and feedback from stakeholders and communities to inform and improve current and future responses. Commitment to the communities. We work for people. We work to protect the communities that are more vulnerable. People who are more vulnerable. I have the chance to work with young people from an area in Veracruz. Veracruz is a state next to the Gulf of Mexico, and these communities were located in areas prone to landslides, and really working with them was one of the biggest learning opportunities for me. These are young people that are very vulnerable, young people who have lost family members in these extreme events. So when working with them, we really take on the biggest commitment to help them support and fulfill their needs for communication, offer them options to be able to respond to such an extreme event in a nearly close future. We need to identify people the community trusts and build relationships with them. We need to build relationships where we vest all our knowledge and our willingness to help. We need to involve them in decision making to ensure that interventions are collaborative, contextualized, and that the communication is responsibility of the community. Social media is so relevant today. We need to use them to engage the public, to facilitate communication between peers, create situational awareness, monitor and respond to rumors, public reactions and concerns during an emergency, and to facilitate responses at the local level. Gender is so important, as gender relations shapes people's abilities to prepare, to survive, and to cope with and recover from disasters through interaction with diverse social structures and are shaped by the physical and cultural environments. Risk communication can provide different tools for managing the different stages of disaster. It is critical to understand how gender relations operate in homes and communities during a disaster and during the response and recovery phases, as this can help establish guidelines for successful risk communication. Gender relations precondition people's ability to prepare for, to survive, to cope with, and to recover from disasters through interaction with diverse social structures and are shaped by physical and cultural environments. Regarding the development of materials and the way they are transmitted, it is important to recognize gender aspects. To address environmental risks facing women, there are 3 key aspects to consider: protection, participation, and prevention. These aspects should be considered when developing a risk communication program. For example, in terms of communication, when children are affected by a public health emergency, their developmental levels and psychological reactions must be taken into account. There's a group in Mexico from the Autonomous University of San Luis Potosí. They work on risk communication. When working with children, they ask children to draw, and they can evaluate what is the child's risk perception based on their drawings and understand how we can help their children manage their fear, and they can feel more secure and safe with people like their teachers, their parents, of course, and also educating their parents in how to express and transmit security, safety, and certainty to their children. So that means there's collaborative work where children can feel their needs are met and express their emotions and have the support of their parents. In many societies, women continue to have lower educational levels, even lower literacy rates. So the situation must be taken into account both in the way messages are crafted and delivered. This is also important in big countries like Mexico, where there are many indigenous populations that do not necessarily speak Spanish, and many times we need to rely on translators. Now, we need to be careful in working with translators because they do not necessarily always convey the message that we want to convey. So we need to find other ways, other mechanisms, for example, working with puppets, for example, when we work with children, as that is very effective when trying to convey a certain message. Studies show that women lack information about climate change policies and protection against the various effects of climate change. An example of this is the La Masica community in Honduras received gender-sensitive community training on early warning systems and risk in 1998. The population did not report any deaths during the Mitch hurricane, as the municipal government was able to evacuate the population in a timely manner. This is why risk communication in vulnerable areas is so important, as we can really see the benefits for the population as they are not as severely affected. Risk communication can be essential in situations like this, particularly to reduce violence. In Honduras, after a disaster, a very successful message was violence against women is a disaster that men can prevent. When we engage children in crisis, emergency risk communication should be more frequently and highly informative for parents. So that is education to parents when there are extreme events is highly important to protect children and to work as a family unit. They are very prone to experiencing anxiety related to protecting their children, and we need to help them cope with it. School-based communication strategies offer an opportunity to reach children and their caregivers. Curricula can be an effective forum for promoting risk communication that is tailored to their developing capabilities. So curricula can also be standardized when the countries are very large, and in places where there is risk, children might already be familiar with the potential risk that they might suffer and what to do in case for protection. Participation of children and youth in disaster reduction in El Salvador, they developed an international camp, and that entailed development of risk maps, the design of community emergency plan, establishment of early warning system, and the implementation of response mitigation and risk reduction plans, among many other activities. Like risk communication, education, awareness raising, health promotion, and practical risk reduction activities. An example of this also in El Salvador are 56 community and 56 youth groups, 1,000 1,120 girls and boys. They were strengthening risk management actions, management of evacuation centers, riverbank protection, protection of their families and communities, and the execution of environmental management projects. Children and young people do not only have specific needs in the event of disasters, but can also play a role as a resource or recipient of information. This is very important in places that are away from cities in our countries. Why? Because young people and children are very interested in participating. They can provide information in informal communication networks around the community as the need may be. Risk maps developed with young groups demonstrate that children understand the risks they recognize and can respond constructively and communicate effectively about them. I have the chance to work in a community up in the mountains to the east of Mexico, where I work with young people. We drew maps where we define the areas where there were some disasters years ago and hundreds of people died. Children became very interested in those maps, and we visited all the households where elderly people lived. We asked them if they had hearing problems, or if there were people in a wheelchair, people visually impaired. And based on those maps, we're able to identify where to find the vulnerable people. So if there's a, for example, rainfall warning, or there could be a potential landslide, children and young people would know who was responsible for assisting one person and where to take them for protection. So they knew where to go. They had a cell phone, and one of them was responsible for assigning people to the different areas, where to go. So they had a map, they had already allocated the roles and knew the household they needed to visit first, where to take these people once they were evacuated. So I would say, for example, one of the children said, I am responsible, but my brother or my sister or my father will help me evacuate people and take them to a shelter. So really we need, in places when there are no further alternatives, or when there are people who are very willing to participate and assist others in bringing them to safe places in the face of an extreme event. 1 minute. Okay. In communities with high poverty rates, adults lack the time to attend training and meetings, or they share a strong sense of apathy or subordination, or the lack of access to information. And children and young people play an important role as interpreters and transmitters of message. They can become catalysts for simple but meaningful strategies to make the community safer. Direct participation in disaster management work gives children a stronger sense of community. And Latin America and the Caribbean had adopted early warning and risk management policies to manage vulnerability to climate change. And in some countries, there are initiatives to reduce community risk. However, coverage and quality are often uneven. And let me finish by saying that risk communication becomes a very important strategy in early warning systems and in informing vulnerable populations to inform potential risks in the face of extreme events. Thank you, everyone, for your attention.
Muchas gracias, Ana Rosa. Fantástico. Thank you very much.
Thank you, Ana
So many
Rosa.
comments. We're running a little bit late here, but I would like to just emphasize the importance of perception, perception of risk. So communication is absolutely crucial to let people know that they actually need to pay attention to something that can impact their lives directly. So we need to consider, of course, always their perception of risk, and communicating correctly and effectively has everything to do with their perception, or building their perception eventually regarding the risks. Now, letting them actually be aware of the risks that menace them, so threaten them. threatens them. So I would like now to invite Jaqueline Machado from Rio Grande do Sul. So Jaqueline holds a degree in public relations and a master's in administration with 15 years of experience in public health and social impact. She's the executive director of Vidya, an agency specialized in implementing programs that integrate communication, mobilization, and innovation to reduce social inequalities. Her work focuses on community-based communication, combining communication tools, behavioral science, and network theory to strengthen community ties, foster engagement, and drive sustainable change. She has led projects with the Brazilian Ministry of Health, us, Fiocruz, and UN agencies such as UNFPA, UNESCO, UNICEF, supporting large-scale public policies across Brazilian states and municipalities. Thanks very much. Jacqueline, the floor is yours.
Boa tarde, assim, uma
Hi,
alegria
good
estar aqui,
afternoon.
muito bom também
It is
poder
such a
ouvir
pleasure to be
Tereza,
here
Ana,
and
uma oportunidade de
such a joy to
aprendizado.
listen
Compartilhar
to
primeiro
Anna
com
and
vocês a
Teresa. And
apresentação.
this is a great deal
Acho que
of a
começando pela
learning
pergunta, em que lugar
possibility to all of
né?
us.
Eu falei que eu venho
First
de
of all, I'd like
Rio
to
e talvez
refer to the fact that
estranhar
I'm
que nosso
talking
estado
from Rio
passa
Grande
por
do Sul.
várias
Perhaps
tragédias
you might
climáticas no
know
Brasil,
that there
um
was
estado
a
que tem
terrible
10
tragedy
milhões de pessoas, em
a year
uma
ago.
semana a
So
gente
10
tinha
million
2 milhões
people,
e
and
meio de
all of a
pessoas
sudden,
fora de
two
suas
and a half
casas.
million
E quando
people
a gente
were
pensa numa
homeless because of the floods.
perspectiva de
So when we
saúde,
think about a health
gira em torno da
perspective of this
desorganização desse
community,
cuidado, né?
that those
Então, eu
floods
tô trazendo aqui
really
uma perspectiva
shook
muito
us
mais de
up.
lições
From
aprendidas,
our
como a Ana Rosa
perspective
falou.
of
Normalmente nós
lessons
não estamos
learned, just like Ana
preparados,
Rosa
ou
said,
então
so we
a gente não
basically
tem
are not
comunicação até
prepared. Of
quando
course, we
esses
don't have
desastres
a contingency
acontecem.
plan, a
E,
communication
então,
plan
olhando muito
when
para
the
trás
thing
do que
happens.
aconteceu, eu
So, of
trouxe aqui
course,
pouco
looking
das
back
lições aprendidas e também
before what
os
happened. So,
insights
of
de
course, we
como a
had a
gente
lot of
pode
lessons
pensar
learned
planos de
inside
contingência.
when
E
we
essa
have to
comunicação ela
think
precisa
about
ser de alguma
contingency
forma
plan.
parte dos
Communication
planos de
has to be
contingência,
part
porque ela
of
pode
those plans.
reorganizar
It
o
could be
cuidado e também evitar
rearrange our care
muitas
and, of course, prevent us from
muitas
having
questões
several
de
issues
interrupção
that are
postergada de
related
saúde.
to the
Então, a gente
interruption,
está
for
aqui
example,
falando de
to
comunicação, né? Mas
healthcare.
quando a gente
We're talking
pensa
about
numa
communication, of course, but
perspectiva
when we think about
de
a
crise
perspective
climática,
that
a
takes
perspectiva
care
aqui é que a
on the
comunicação ela passa
climate
a nos
change
auxiliar
and crisis,
também numa
communication can
perspectiva mais
be a very
individual,
important
trazendo esse lado do
aspect
engajamento de
to
cada
support
indivíduo,
our
seja numa perspectiva de
individual
prevenção,
participation,
seja numa perspectiva
either
de
in
quando
prevention
acontece um
or
evento que a
perhaps
pessoa
when
saber o
something
que fazer,
happens,
e
people
também aquele
have to know
processo
what
de
to do.
mobilização,
And of
que é quando a
course,
gente
there is
pensa
a
de uma
process
ação
of
mais
mobilization
coletiva,
when
né?
we
Como
think
que a gente
about the
organiza como
community as a whole. How
comunidade
can we
para trabalhar essas
organize in
ações de
our community
prevenção
to
e
just
de
work
enfrentamento
issues and aspects
dos
about
eventos
prevention
quando
and
eles
how to
acontecem, né? Então, olhando
face
dessa perspectiva, eu te ensino
events
aqui a
when they come
comunicação
over
da
you?
base numa
So the
perspectiva que ela
communication
vai
has to
informar.
count
Mas para a
on
gente efetivamente ter
information,
essa
yes, but what
comunicação
we
e o
effectively
engajamento numa
want is
perspectiva de
our
corresponsabilização,
participation,
desde o meu cuidado
our
individual
responsibility
até a perspectiva do
from
que
an
eu vou fazer
individual
com
point of
como eu
view. So
posso
what we're going
agir
to
na
do, me as
comunidade
an
onde eu
individual,
estou
what can I
atuando e
do
numa
to
dimensão
my
mais
community?
sofisticada desse
And of course, in
processo,
a
a
more
gente precisa
sophisticated
mobilizar para a gente ter uma
fashion,
ação
we want
preventiva,
to
uma resposta
mobilize
rápida, uma resposta
and
rápida e
obtain a
ordenada quando
rapid
esses eventos
response. And of
acontecem.
course, in
E quando a
order
gente está falando de comunicação de
when things
risco,
happen.
essa
When we
daí eu
talk
estou
about
jogando porque aconteceu aqui no Rio Grande do
communication
Sul,
of
a gente
risk,
tinha um
principally
plano
to
de
what happened
contingência
here
de
in Rio Grande
risco,
do Sul,
e eu
we,
falo também
uh,
de um
as a
lugar
matter
que
of
eu
fact, didn't
precisei
have
estar
a
20 dias fora
contingency
de casa,
plan.
porque
So I'm talking
na
about
minha rua, por exemplo,
me,
não tinha
myself. I
vaga
had
para
to be
atender o dia
20
todo e isso
days
aconteceu em questão de
homeless.
2 horas.
And we
A gente está
had like
preparado para isso, né? Então, quando a gente está falando
kind
de
of in two
comunicação para a
hours, all of a
perspectiva de
sudden we
risco,
had
a
a
gente quer
river
antes
just
resolver
outside my door.
sobre o que
So we're
acontece
thinking
antes, que é
about
gerar
that
consciência para
what
dar
happened before. So
respostas. Eu
first
acho
of
que
all, we
esse
have
é
to
o grande
generate
ganho também do
our
passo que eu trouxe para
awareness. We have to
diante,
get ready.
por
And
pior que
this,
sejam
when
as
we lived this
perspectivas, o
through this
grande
kind of
ganho são as
situation,
nossas
so no matter
habilidades, né?
how
Da gente entender que
horrible
precisa
it
estar
was, but
preparado
we
para
learned
isso. A
something. We have to
comunicação é parte
understand that we
desse
have to be
processo. Então, a
ready.
gente
And
tem
communication is
essa
part of this
perspectiva do
process.
antes, que é
When we have
gerar
this
consciência e preparar respostas.
perspective, the
Quando isso está
before,
acontecendo, né, numa
get ready,
perspectiva de salvar
have the
vidas, de
response,
avançar
and when we
comunicação.
have to
E nesse
save
período eu tive a
lives and
oportunidade, nos
guide
últimos
in
2
terms of
meses, de
behavior.
profissionais de
Of
saúde
course,
que
the last two
trabalharam
months, we've
muito
been
durante
working
esses
with
eventos
some professionals
e me
that were
traziam
really engaged
uma
during
quando eu
our
falo de
floods last
advocacy,
year,
eu
and
só queria que people would say, I just wanted to have someone to tell me what to do when we were living that nightmare. So, of course, there is the communication as a coordination aspect in communication. We do something when things happen. And of course, we have to pass information. We have to talk about communicable diseases. We have to talk about what might happen after a flood. And of course, the process with regards to healthcare, or you don't have a hospital anymore, you don't have an ER, so you have to go somewhere else far away. So we have to rebuild the trust in our public health system. We have trauma. The trend could be like our healthcare could be less relevant to the person. So we have to think about this protocol. We have to build this protocol communication so that when climate change happens, we have to think about before, during, and after. Just a break now.
Ué, duas da mesma apresentação ou não?
Não, duas de você.
You see
Parece que
two
você tem
presentations
dois
of my
monitores e a
partner. It
gente tá
seems that
vendo
you're
dois
using two monitors
monitores ao
and
mesmo
we are
tempo.
looking at two monitors
Eu
at
tô
the
com um
same
só.
time.
É,
Actually,
tenta
I have only
abrir,
one. Yeah, then try please to
Tá, um minutinho.
reset your, yeah.
E
a
agora?
gente ainda... Não, você ainda tá
Basically, it's the same. Maybe
postando os dois.
you're showing both
Deixa eu ver de novo.
screens.
Para mim só aparece uma tela também.
Só aparece para você uma tela?
Oh, it's
Então
only
tá bom.
one for me.
Então
Then,
vamos
so that's
continuar.
okay. I'm
Aqui
sorry,
tá aparecendo duas e para Meg aqui
Jacqueline.
também.
For me, I have
Continua
two
assim.
screens and only one.
É porque
Anyway,
eu tô com todas elas
the
fechadas.
point is I have all of
Vou colocar
them
aqui novamente.
closed
Qualquer
now.
coisa
Let
pode
me
avisar.
try to turn the screen on again now.
Então, nesse sentido, assim, quando a gente pensa em comunicação,
So when we think
ela tem uma
about
parte de
communication,
cuidado, né? Porque quando acontece
this has to do
um
with
evento climático,
healthcare or
afeta
care in general.
muito
When
a
there is a
rotina
climate
das
event that
pessoas, a
actually
comunicação ela
affects
vai
the
ter essa
routine
potência
of
de reduzir
people,
o pânico,
communication will be that
aumentar
powerful of
as
reducing
medidas sanitárias
panic,
que podem salvar
increase the
vidas,
level
mas
of
se ela
many
for mal executada,
health
ela pode
measures that
causar
may
desinformação,
save lives.
insegurança e
But if
sobrecarga
it
de
is not
serviços.
well
Por
executed, it will
muito
actually
que os
produce
sinais
quite
de
a lot
alerta
of
são
overload of
dificuldade
services.
dos sinais de
In the
saúde
climate
lidar com as
crisis
fake
here
news,
in
né?
Rio Grande do
A gente
Sul,
tinha
we had a hard time to
nunca
deal with fake
passando
news because there
informação,
were
informações
many,
equivocadas,
many
desorganizadas,
players
muito mais
conveying
seletivo
wrong
do que a própria
information,
transmissão
then
que a gente
they
estava vivendo
impaired
já estava
the
proporcionando. Então, a
services much
comunicação
more
ela
than
tem
the
uma potência
condition we were going
para ser
through. So
parte do processo
communication
de
is
cuidado, mas ela
powerful
também
in
tem
terms of being part of the healthcare
esse
process,
princípio de cuidado
but
de
it
forma
also
não
is based on
necessária.
this
Ela vai
principle of
desorganizar
care.
aqueles
If it is
processos, né?
poorly
Então, quando a
executed,
comunicação
it
ela
will
falha,
disorganize the
não é somente
processes.
o
And
erro
so when
internet,
communication
a
fails, we
informação não
don't
chega, é o erro
lose
que espalha e
only
principalmente a
news,
comunidade
but
que
it's
se
help that
desorganiza.
doesn't arrive,
E eu
it's
vou chegar
fear
um
that
pouco mais
spreads, and the
nesse
community that gets
expediente, porque tu
disorganized.
pontuou a importância da
From my
comunicação
part in Rio Grande do
comunitária.
Sul,
Assim, então,
community communication is very, very
Ana e Teresa
important most
falando
of the
sobre essa
time.
perspectiva mais global,
After hearing
no sentido de
Anna
comunicação,
and
e também
Teresa speaking
trazendo essa
about that,
perspectiva
and
de
also
como
bringing
a
this
comunidade
perspective
pode
of
se organizar.
how the
E aqui
community
eu
may
trouxe
get
só a
organized.
comunicação do
Because here we
governo
saw
para
that
gestão, ela não foi
communication
suficiente.
coming from the
Tinha que se
government
organizar
itself
para
for
se
management
comunicar
purposes was not
de modo
enough.
que
So we had to
consiga
organize community
identificar as
networks
demais
so that we could be
fraquezas
more
desse tipo de
effective
comunicação.
and
E
be
aí, assim, a
swifter in
gente tem
terms
que
of
olhar
our
para a
communication
comunicação como
process.
uma
So we
infraestrutura
have to look
de
at communication
comunicação.
as a
Ela não
critical
é um addon,
infrastructure
ela não é um
in climate
suporte, ele é
events. It
parte
is
do
not an
processo.
add-on, it's not a support,
Então,
it's
a gente
part of that
precisa,
response.
ouvindo dos
In this
profissionais, a gente
sense,
ouvia muito isso, olha, só queria alguém que me
we
dissesse
heard people
exatamente o que
saying,
precisava
well,
fazer.
I would
Então,
like
nesse sentido,
to
olhando para o
hear
protocolo de comunicação,
only the
da
things I
porta
would
para
need to
dentro,
do. And
ela é um
so
instrumento que vai
looking
orientar as equipes
towards communication
departamentais,
from the door
então ir para cada um para um
in
lado e as pessoas
or
não sabem muito o que
inside
fazer,
of
como
the
isso
door
acontece,
itself,
então precisa
many people
do
would not
protocolo
know
que
what to
funcione da
do.
porta
So
para
we need a
dentro, que
protocol that
organize o
happens
serviço,
from
e da porta para
outside
fora,
in,
em
that
si,
organizes
vai
the service, and also
orientar a
from
população.
inside
Então, é
out
preciso que
is
a gente
good
olhe para
to
esses dois eixos,
provide
a
guidance to
comunicação
the
interna
population.
e
We need to
a
look at
comunicação
two
fora das
axes.
populações.
There should be an
Então,
internal
assim,
communication for the
dentro
teams
dessa
and a
perspectiva, a
second
comunicação ela é
external
parte do plano
communication
de
for the
contingência.
population. It is
O
part of the
protocolo de
contingency
comunicação,
plans.
ele vai
A
comunicar
communication
quem, para quem e
protocol
por onde.
will
E quais são os
communicate
serviços que eu
what,
posso
for
acessar
whom,
depois que eu
and
consigo
where.
voltar para casa.
What are the
E muitas
services I can
pessoas
have
dessa
access
base
to
térmica
after
que
go back
suas
home?
casas foram
The
dizimadas,
houses in
o
Rio
que que eu
Grande do
faço?
Sul
Eu
were
tiro
destroyed, as you see there.
centralizado em
On the
determinado
image I
lugar
was
de trabalho de
careful
saúde, como que eu
about
interrompo isso?
centralizing, for
Então, isso de
example,
comunicar o
our efforts towards the basic healthcare units not to interrupt this kind of service. We need to guarantee, not only thinking about the state itself, but we could think about small units like the municipalities. There should be at least one person in charge of updating information quickly and clearly. What is reliable information? Anna mentioned that having a reliable communication, having a spokesperson, and we saw that this is important here. In this sense, when we think about a contingency plan, without communication, there's no way of coordinating, and without coordination, there's no efficient response. This is why I bring to you this perspective that the communication has to be part of the contingency plan. It's not an add-on, an annex, an attachment. This is not something we will do whenever we can, but it has to be part of a protocol. And now thinking about communication and vulnerability, we have to think that climate change amplify inequalities. Poor, black, peripheral, outskirts, rural populations are the most affected, and they have least access to communication. So when we think about communication, we cannot think that all the same strategy will fit all. Most affected populations are those who have less access to information. This is what a little bit of what has been brought. The information will not reach the same way to an engineer or a solo mother who lives in a small village. At the same time, she might have been losing everything she had. So by focusing, when this kind of thing happens, when the event happens, people in crisis, they listen less to things and they remember less. This is why the message has to be simple, clear, repeated, and coming from a reliable source. The principle of simplification at the moment of the event, and afterwards also in terms of healthcare, that has to be the guiding point in terms of the communication process. And also thinking about the communication planning in itself, without taking into account inequalities or inequities, communication becomes a privilege, and this may kill. An example of what happened in 2025, we had 1,600 fatalities, and most of them are people living from in the outskirts of the cities. So the social networks or the social media, they are not the only source and the only reliable source of information. Our main process of learning in terms of communication here in South Brazil is to strengthen the means of exchange of community information. We are talking about the understanding of the communities with local, like radio stations, local leaders and these things. The idea is that we think about establishing communication structures that are sustainable because of the level of reliability that people have on the members of the community. So those community structures, they can be a critical infrastructure at those moments in which they are decisive. For this communication to operate, to work, it cannot be elitist, neither elitist nor technocrat. So when we think about increase in the level of vulnerability when those events happen, so, for example, in the Maria hurricane in Puerto Rico, the lack of communication towards vulnerable populations that caused 26 deaths because of leptospirosis, because of the lack of information. So we cannot put everybody into the same basket. We have to have a very centralized look on the territories where people are more vulnerable, so that for those individuals, a perception of the risk limits, they face so many other risks that realizing a health risk takes much longer because they have many other concerns in mind at this time in life as a whole, so that the perception of that limit, that threshold in terms of health is very broad, very wide. How do we narrow that down? Causing them to understand that people should go for the services they should be going for at the moment of crisis. When we think about community communication, when we think from the government perspective, that communication is like it were fireworks. In other words, what happens to the fireworks? It actually explodes, blasts, and then it is extinguished. When you centralize information in the government, it's an information that comes and stops. Now, when we think about multiple exposure, the idea is that we actually should move to the last model on the right, which is called a decentralized communication network, in which the person will have access to that information by means of different channels. community leaders, healthcare professionals who can talk to them, government, community radios. When we establish that communication network, which is more distributed, we have what is called social redundance. In other words, multiple exposures to the same information that establishes legitimacy and it encourages action. So, from a perspective of thinking about communication in those spaces, is that we can decentralize that communication and create a community network that strengthens access to the most vulnerable populations. So, looking at this perspective of how to think about communication in the communities, there are four axes that are very, very guiding in the sense. First of all, we have to map the linkers. Who are the community leaders? How can I establish a network of preparation and connection with these networks? And that happened here in the state of Rio Grande do Sul. This is a group of a specific community that started rescuing children in schools and so on. We counted on an organization, on a community that was disorganized. That was quite helpful. We know that this is something that will happen again here in Rio Grande do Sul. It's important that we can organize a network and map what are the organizers of those communities. Second thing is to have clear roles. When that happened, people did not understand what they should do. People went to the shelters, professionals did not know what to do. So it's important to define in advance what each person should do, going from volunteers all the way to healthcare professionals. Third point is that there has to be somebody in the network system, which is the management of disinformation. We spent a long time to fight fake news, several epidemics that were broadcasts that did not exist. And so, well, government has to have a group that fights this, fake news, and there has to be somebody in charge of updating that information in a very swift and clear way. So when we are to think about the establishment of a contingency plan, the first steps would be within the communities, first of all, to create a contact bank of community leaders, those who will be a focal point to convey information. Here in Rio Grande do Sul, we'll have some houses of African religions, etc., businesses, etc. They were not mobilized to become vectors of information. It's important that we develop also standard messages, simplified messages, and we spoke about that, how important simplification is, and also train volunteer and healthcare workers and in terms of this process of communication so that we can offer this space of access to information. And now, moving towards the end, we spoke about communication before the crisis, during the crisis, and now post-crisis. What happens when people lose their homes, their family members? We have, especially in terms of mental health in the state of Rio Grande do Sul, we are going through an epidemic of post-crisis mental health epidemics, and it will play the role of providing emotional support to the affected populations and workers, reducing stress, mourning, and actually this is included in the protocol. This will reestablish confidence in the local healthcare system as well. That needs to show that the government is there, it's present, and that the population will be taken care of. For example, when you go out from the perspective, I worked for a long time with HIV and TB, people who had their care discontinued. How can you retake the link with these people? So there are several diseases involved, and each group will need to continue with those types of healthcare, because we have an organization of healthcare which is very Cartesian, and it suggests that everything will be okay in that municipality. But look, there will be an external factor, and that healthcare effort will be dismantled. And third point would be to promote co-responsibility, engaging volunteers, etc. We had 2.5 meters or 3-meter high water level, and so the vulnerable populations did not have the perception of that risk. And it's important to report information about how the water should be treated, what will be the vaccine schedule for, etc. All these things have to be included in this protocol. So among these different components of communication, of post-event communication, we should map those channels? What are the neighborhood groups that could be used for that, assigning them with different assignments and responsibilities? We need to centralize communication through the social media, but in some way it's not going to reach all, not to the vulnerable populations. So we need to strengthen those community networks. And to finish, maybe I will be somewhat redundant because my colleagues mentioned that already, is that when we think about language, it's important to simplify and reduce attrition. In other words, the simpler and the more straightforward the behavior, the expected behavior is, a higher level of adhesion, of compliance. For example, boil water for 5 minutes before drinking and start using checklists, because when those things happen, people get quite stunned with these things. We need a messenger who is reliable, and community leaders are the reliable messengers. We need to establish those communities. Social standards and social proof. These are things, well, people tend to imitate, to mimic the behavior of the majority. For example, if 90% of your neighbors have already been immunized or they have already been evacuated, that creates a sense that everybody is doing these things. This so is relevant, and I need to do this as well. And to also work with this approach between losses and gains, rather than saying that boiling water avoids disease. You might say that if you do not boil the water, that may cause severe diarrhea in children. So with vulnerable populations, if you discuss this from a negative perspective, this is going to be more relevant rather than simply saying that this is going to avoid or prevent a disease, and we need to be more objective. And also work with time support. For example, I did not know at what time I should go out of home because I thought I could stay for longer, and so the water went up. And at some point, there comes an alert from the mayor saying, look, not later than 2 hours, just leave. So we said, do that right now, because people do not have the perception of the level of risk. We have to have a time support. Or if you have had, if you are around contaminated water, you need to go to a health unit. So this is very relevant for the development of behaviors. And to finally finish, if climate change is a collective challenge, communication is one of our tools to act together so that it becomes part of the contingency plan, that the government and managers may include these things as something that will steer and guide actions before, during, and
Muito
after.
obrigada, Jaqueline. Thank you very much, Jaqueline, and all of you. These were amazing presentations. We had really an amazing session today. Thank you very much. We're running a little bit late, but we have so many questions for you. I'm going to read some of them over here. Please feel free to choose which questions you would prefer to answer. So, Teresa, would you recommend the development of a standalone communication strategy for health and climate adaptation, or communication can be integrated into other broader government communication strategies? I think Jacqueline talked a little bit about this right now. What are the strategies to mitigate the effects of misinformation about climate change and health? Jacqueline mentioned the social media, and of course, not everybody has the access to the internet and to a cell phone. But not only that, people receive a certain type of information, the type of information they are interested in, and maybe they're not exactly, they have already all the channels that are fueling the right information. So maybe talk about that in a context where a large part of the Haitian population from Haiti has lost confidence in the authorities, institutions, and even certain humanitarian organizations. What communication channels and approaches could really reach, mobilize, and convince communities from Haiti to adopt behaviors favorable to the fight against climate change? Very good question. Remarkable, clear, and clean slides. Teresa, thank you very much for it. As a health professional in Chile, it has been very challenging to engage colleagues into the gender perspective, which Ana Rosa also talked about, climate change related, but otherwise to what mechanism you recommend to make them to raise awareness. I think this question can also go to Ana Rosa. How to implement effective controls on companies, government, and other generators of pollutants. So very important to talk about the private sector with production and use of pollutants in laboratories, use of weapons created on farms and similar. And how do you promote the knowledge factor for health professionals so that users can then access information in common language and receive preventive rather than curative follow-up? I would ask Maggie, please, if you can put all the questions in the chat so they can see it, because I know I'm talking a little bit fast. So Ana Rosa, how practical is it to protest messages during serious crisis, protest disasters or emergencies, given that there will be very limited or no time to do so? So how to act in the emergency? What do you recommend when transmitting information to decision makers? One of the major challenges related to climate change is facing workers who work outdoors, such as street vendors, rural workers, and construction workers, who often lack islands of hydration and protection. What are the possible means of communication for these workers and all the other
En cuestión de las personas que trabajan en exteriores, pueden ser
As
estas
for
personas de la
people who
construcción, pueden
work
ser vendedores
outside,
ambulantes, pueden
they
ser
could
las
be
personas que
people
trabajan en el
who
campo,
are
como decíamos.
selling
Esto es muy
the
importante,
things
implica
on
una
the
campaña en la
street. They
cual,
can be
por
people
ejemplo,
who work in the field.
en el caso de los problemas de campo, yo he tenido la
Uh,
oportunidad.
skip a few, but I think you can read it also on the chat. And also to Jacqueline, I'll read as an official report oriented toward political authority. How has this been reflected in public policies in different states? What are the best practices that can be replicated? I think it's a crucial strategy, science, society, and academia, the best triangulation to address a complex problem like climate change. So my question is, why the private sector isn't included, since they are the main generators of pollution? So without these actors in the commitments, we simply adapt but have little impact on the causal factors. How to bring together all public and private efforts to systemize the work so it isn't duplicated, and to form specialized teams and working groups such as those for health infrastructure and climate change, another group for clinical care, another group for health operations, another for epidemiological surveillance. How would we focus and allow for the participation of the public and private sectors, since the current situation makes it impossible to differentiate efforts? And finally, how can indigenous communities better leverage influence with funders when the traditional approaches to emergency management don't align with colonial funding structures, and when successful indigenous-led practices are not being shared and recognized, especially when highlighted by non-indigenous allies? I think this a few of the many questions. Please feel free also to comment on each other's presentations and to dialogue among yourselves. Thank you.
Those are a lot of questions. So I will do my best to kind of briefly respond. But first, I just really enjoyed each of your presentations. I will highlight, I agree about the importance of perceptions. And also, Ana Rosa, when you talked about humility and really understanding that what we think is going to be effective may or may not be effective. I thought that was an excellent point. And I also, with Ms. Machado, the communication as critical infrastructure, I think is hugely important. And that speaks to one of the questions of whether there should be its own thing or integrated into the mechanisms that currently exist within a government structure. I think that really depends. And there's not a one size fit all answer, right? To the extent that it can be infused throughout a system, yes, excellent. There's already those networks in place. But to the extent that that is difficult to do, then something separate needs to be set up. And that's going to depend on each locality and specific thing. For the question about misinformation, I am going to drop a webinar in the link that a colleague from the consortium did about misinformation on climate and health, just because I don't really have the time to get into that there. And then finally, I think I'm missing some, but I will comment briefly on the Haitian question. I think that's such a difficult context, right, where trust has been lost for a good reason um, in many institutions. And so I think there and otherwise, really starting small and then expanding out. So is there one community where things are going really well, or where you have a partnership that you could really seek to expand and do really good work in one place, and then network from there, at using that as an exemplar would be my kind of off the cuff response very briefly. But yeah, thank you for all the work everyone in this room is doing.
Si me permiten, tengo la experiencia de haber trabajado en Panamá,
Well, if I
específicamente con
may, I
zonas
have the experience of working in
en ciudades
Panama,
cercanas. Y aquí la
in
importancia
some
era de
cities or
hablar con las
areas around
personas que eran
cities, and it was important
los
to talk to the
dueños de zonas
people
en donde había
who
pesca de diferentes
owned,
tipos de
um,
cultivos.
for
Entonces, estos
example, the
hombres
lands
trabajaban
where there were
horas al
different
sol
crops. And so
y
we had
tempranamente
people
empezaban a tener
working
problemas
for
renales.
hours
No
and
tenían
hours
acceso a agua, no
outside.
tenían acceso
And
a
very
descanso.
early
Y
on, at
entonces
an
la
early
propuesta
age,
fue
they
comenzar
started
con los
having
servicios de
kidney
salud de
issues.
esta
They
pequeña
had no
zona
rest
y
hours.
hablar con las
And
personas
so we
responsables
went to
de
talk to
salud
the
para que
people
hablaran con
who
los
were
dueños o con
responsible
los
for
patrones
healthcare
de
in
estos
those
grupos
areas,
y
for them to
presionarlos
talk to
para
the
que
owners,
en
to the
principio
bosses of
crearan
these
zonas en donde
men,
pudieran
so that they
descansar
could create
cada hora y
areas
media o
for
2 horas y
rest,
media en
so
una
that they
zona
could
sombreada.
rest every
¿Por qué? Pues
hour
porque
and a
el sol
half or
en
two
Panamá
hours
es muy
in a
intenso,
shaded
las personas
area,
sudan mucho, no tienen
because
acceso a agua y
sunlight
entonces se
is
le dijo,
intense at
necesita que
that
les
time.
compre
People
un
sweat a
sombrero, un
lot.
buen
And
sombrero
so
para
they
que
were
no
told that they needed to
tengan la
buy
caída del sol
hats,
directo por un lado.
so that
Por
they
otro
don't
lado, que
have
cada 2 horas vengan a
and
descansar
to
a este
endure
espacio,
the
pero que
sun
además en este
directly.
espacio haya
And they
agua,
also need
que
to
se les
rest in
compre
this
una,
shaded
que
area.
la que tienen los
And
niños,
also there
este,
needs to be water
a
there.
disposición
They
en donde
should
traigan agua
have a water
permanentemente
bottle,
y ya
for
que se vaya a
example, where
terminar el
they
agua,
carry
se vayan a
water.
descansar
And as soon
esa
as their
media hora y
bottle, for
tomen
example,
agua.
runs
Y
out,
claro,
they can
fue
go there to
difícil porque
rest for half an
implicaba un
hour.
gasto de parte
And
de ellos,
it
¿no?
was
Pero entonces
difficult
lo que se
because
hizo fue
these involved an
concientizar a los
expense for
servicios de
them.
salud para que fuera
But
algo
we trained
obligatorio
the
de que estas
healthcare
personas
services
cumplieran con esas necesidades
on this
para estas
to
zonas. Yo creo
establish
que eso
this
es
as a
importantísimo
mandatory
porque
thing.
yo creo que
And
hay
I think that's
muchísimas zonas de
really
América Latina en
important
donde
because there
este
are
tipo
many areas in
de
Latin
riesgos,
America
¿sí? Y
where
personas
these kinds
vulnerables
of
están
risks
sufriendo.
and vulnerable people are suffering.
Her mic is off. Her mic is off.
Acho que vou focar
Thank you for
nessa
reminding me.
perspectiva assim de
So
o que o
let
Rio
us
Grande do
talk
Sul está
about the
fazendo e as coisas
perspective
que
of
estão
what we've been
acontecendo, né?
doing here in Rio Grande do
Vejo que
Sul
o
after
governo do
this
estado
situation.
de uma perspectiva mais
Of course, our
generalista
state government
trouxe
had
uma coisa
a
de
more
comunicação
general
e as comunidades, mesmo
perspective.
que eles são muito
Now there
pequenos,
are communication
eles,
protocols.
assim,
Of
quem
course,
já
our
passou
communities are
por
very
isso começa a
small.
rever os seus
Those who lived
protocolos,
through that
não só de
issue,
comunicação, mas de
they are
organização da
reviewing their
cidade. Mas isso
protocols
ainda está muito nos
and their
municípios que
care.
viveram
But of course,
essa
we're talking
história
about
e que conseguiram
the
ver
municipalities
efetivamente
that
as pessoas
lived
perdendo
through the
suas casas,
nightmare.
as pessoas
They saw their
perdendo o
citizens
curso da
losing
cidadania.
their
Agora, os municípios que não
home
sofreram isso, a gente vê
uh,
que isso ainda
and
parece
their
ser uma realidade
jobs. So
distante.
those
Ainda que
other
situações não
counties
chegam
that
de um dia
didn't
para o
do
outro,
that
ainda
think,
tem.
oh, this is a
Então,
very
tem
far
aqui,
away
a gente
reality.
só vai ter uma
As a matter of fact,
mudança
the
na
impression that I
reação,
have
não só numa
is that
perspectiva de
we
protocolos
might
de
have
contingência, mas de
just
protocolos
a
de
change
comunicação
in this
depois que
attitude
passa.
in
Eu não
our
vejo isso no Rio Grande do
communication
Sul, essa coisa de
protocols and a
forma
change of
preventiva,
mindset
ainda
after living
reativa,
through
mas o que eu vejo são os
such
municípios
a thing.
sentando,
What I
discutindo,
see is that
vendo quais
now
são as
what we're
grandes
doing is
medidas,
we're
o que
sitting
se
around
pode
the
fazer para
table,
isso não
checking
acontecer.
what
E acho que investir
lessons
efetivamente
that we've
as nossas
learned. And of course, we
infraestruturas,
had
as nossas
some
cidades, e que
floods,
não houve protocolos de
years
contingência
before.
depois
There were
disso.
just two
Eu
or
acho que
three
essa
cities
comitiva em
that
larga escala, ela
had a
abriu
nightmare, but there was no
os
protocol. But
olhos e a
now with this
consciência para
large
que isso não
scale
acontecesse,
event,
mas eu ainda
that
não
was
vejo
an eye
municípios que
opener.
não sofreram
And
isso se preparando para quando
I
isso
see that there
acontecer,
are
e talvez
counties
seja o
that
próximo passo,
still
depois vemos que a sua
really learned
responsabilidade foi
lessons. So this
muito
is our
clara para isso,
advice,
colocando
and
essa
our
discussão nos
municipal
congressos e nos fóruns, mas ainda numa perspectiva mais
farms and
apreciativa do que
congresses
efetiva.
are trying to shake up and make them open their eyes.
Oh, thank you very much for all the answers and the comments. I would actually, in the end, and running a little bit late, but I would like to thank everyone that participated here today. our three presenters. I would like also to thank the invitation for the Ministry of Health to be here today, the Ministry of Health from Brazil. It's a great pleasure to be part of this debate, to be part of this great effort to scale up actions towards fighting climate change, to actually adapting and mitigating climate change. And somebody mentioned, I think it was Teresa in her presentation, and I think I didn't comment on that, but how mitigation is absolutely fundamental. The information regarding that, reducing emissions and the use of fossil fuels. So I'd like to thank everyone, for also your audience, for participating at the chat. And until next session, we'll see you next Thursday. Thanks very much. Bye-bye.